Welcome. I am Dr. Patrice Berry, and today I wanted to talk a little bit about ChatGPT and mental health. This is a topic that a lot of people have been talking about, and I've seen a few different articles, and I've linked the articles that I will be referencing down in the description. But with ChatGPT, a lot of people are looking at and considering how is this going to affect mental health, specifically people that maybe try to use it almost like a therapist. And specifically with that one, I want to start there because you can ask it questions. But the AI was not developed to be able to diagnose, and the some of the information that it provides may not be accurate. So I've also included some links to if people are looking for affordable therapy for things that can be supportive for them. I've listed some things down below. But there are some apps that do use AI to generate automated responses when people are struggling, when people are having difficulty. But I don't think that in any way replaces having a licensed therapist, because one of the most important factors within any type of therapeutic relationship is the relationship that the person has with their therapist. They've looked at the different styles. So one therapist does cognitive behavior therapy, another therapist does dialectical behavior therapy. Like therapists, they each have their own different style, but one of the most important things that really helps people get better is that relationship that they have with their therapist. And it'll be interesting because I think they will try to do things to generate some type of relationship with AI. So they might give it a name, they might even give it a face, and with virtual reality, they might even have ways that you can interact with the AI, maybe in a therapeutic setting. But I don't think this is going to replace working with a licensed therapist. And technology has changed therapy in many ways. So for me personally, when I started out as a therapist, a long time ago, we didn't do online therapy. I was not trained in how to do online therapy. But then March 2020 happened, and I had to learn how to do these things. And so I do think that this technology is going to impact mental health. I do think it is going to impact the ways that people look for information, but I don't think in any way that it's ever going to replace it. If people can find affordable assessments, affordable ways. And that is difficult. Like, no lie, that is difficult to find the right therapist, to find people that you connect with. But I do think it will be important for people to be aware that, first of all, the technology was not developed for this meaning. Number two, the information may not always be accurate. And then number three, an important factor to remember when engaging with any type of artificial intelligence, with engaging with AI, is that it wasn't developed to diagnose. And so if I'm asking it questions, versus if I'm talking with a therapist, they might say, "Ooh, that kind of sounds like this might be this," because they have clinical experience, they have clinical knowledge. I do think they will probably try to develop something down the road that might be able to do this, but where the AI is right now, it is not able to accurately diagnose things. Um, I try to work with my patients, with my clients, to know that they are the expert on them and I am the expert on the psychology stuff. And when we come together, sometimes they get a general idea of how they're feeling or what they think might be going on, and then we dig deeper together to get an idea of what's happening for them. But please be careful as you're engaging with AI, as you're engaging with different things. Because the thing that I don't love about ChatGPT, I have played around with it a little bit. And if I ever do use it when creating any type of content or anything, I will link that portions of this was, developed using ChatGPT. I don't love that it doesn't give you the source of the information. So if I Google, tips for depression, then I'm going to have a list of different articles, different sites, different videos. I'm going to know where the information came from. But if I Google the exact same, or not Google, if I go to ChatGPT for this, it is not going to give me it's gonna give me a response, but I'm not gonna know where that information came from. And I do think it's important that we know kind of the source of the information. And so I hope this was helpful. If you have questions, let me know if you've had experience using ChatGPT so far. I think there are some great uses for it. I think there are some concerns, like legitimate concerns that people have with it possibly replacing certain jobs, with it how the impact that it's going to have. But I would just be cautious as you're engaging with any new technology. And if you have any specific content that you would like for me to cover, please let me know. I edited the channel name, if anybody noticed, to Dr. Barry Responds, because as a licensed psychologist, I really like being able to provide this educational content, this educational information to give you accurate stuff. That doesn't pertain to your exact situation, but I can give you general information about these topics. So I hope you enjoy the rest of your day.